Hi everyone, my name is Dr. Noella Moga, an anesthesiologist, and today we'll be talking about getting ready for your surgery, what to expect, and how to prepare. First is the pre-surgery instructions. Your surgical team will have met with you and given you a list of what to bring on your day of surgery. This is in reference to patients who are coming home for an elective procedure. Fasting. American Society of Anesthesiologists has guidelines on fasting. One of those is that you should be fasting for 8 hours. They will tell you to have nothing by mouth after midnight, except for a specific number of medications that you're allowed to take with a sip of water on the day of surgery. You should check with your surgical team on which medicines are allowed and which ones are not. And this will depend on the type of surgery, the surgeon, and on your own particular history. Now, sometimes patients might ask, why do I need to have nothing by mouth after midnight if my surgery is scheduled for noon? In general, this is because for elective surgery, sometimes if the first patient doesn't show up, then we move the second or third patient on the list to be performed early in the day. And if you are not fasting appropriately, then you cannot be moved up in your schedule. Next is what to wear. You should wear loose clothing that is easy to be removed. Leave all jewelry at home and leave all your valuables at home. Most surgery places will have a place for you to lock your belongings, or they'll give it to your family member. We like you to remove all piercings, such as piercings in hidden places, like in your belly button, or on your tongue, on your nose, your eyebrows, for instance, because those may interfere with the electrocautery and the return pad used for making sure that you don't get skin burns. If you have any implantable devices, do tell your surgical team. It is best if you do not wear perfume, as some people in your medical team may be allergic to perfumes. And it's also best if you do not apply a lot of lotion on your body, because we have to place things like stickers on your body, EKG lead stickers, and those may not stick very well. Also, the bovie return part has to be placed somewhere on your body, and they'll not stick very well if you're very oily. I ask you to remove contact lenses. You have contacts on. When you're asleep, there's decreased tear production and there's decreased movement of your eyes. So those contacts can get dry and they can cause corneal injury. All right, before going back into surgery, we ask you to remove any hearing aids or dental appliances. We'll usually provide you with a cup to place those, but if you have your own holder for those items, we ask that you maintain them with you. Common knowledge is that for hearing aids, while you're undergoing anesthesia, you're usually asleep and there is no need for you to wear those hearing aids. But more importantly is that those items can get lost easily and they are expensive and valuable to you, and we do not want to lose those. Now, in terms of emotional support, it's normal for you to feel nervous about surgery. Ask as many questions as you need. You can bring something that brings you relaxation to help you prior to your surgery, whether that is a religious text, a friend, a soft squishy pillow, or music that you want to listen to while you're waiting for your surgery. We do encourage that. There are chaplain services. Simply ask the hospital beforehand if you'd like to speak to a chaplain or a religious advisor for your religion, and we can make that happen for you. What should you bring with you? Okay. For elective surgeries that you get to leave home on the same day, you should bring a person to take you home. One of the most important items we look for in patients who have day surgery is that they have an adequate means of support to get them back on their ride back home. Whether the person is taking a taxi or a private vehicle, we want a responsible adult to be available to monitor you in the immediate hours after surgery and to make sure that you enter into your home or apartment safely. You should bring your ID and your insurance and a credit card in case you have a balance of payment due on the day of surgery. In the next chapter, we'll talk about the role of your anesthesiologist. If you find this useful, please leave a comment. This is a general overview and not meant to be specific at all in this first chapter of what to expect on the day of surgery.